Okay, my study is regarding cost effectiveness of antineoplastic agents preparation for personalized cancer therapy in the University Hospital Center Mother Theresa in Tirana, which is in fact a tertiary hospital and the major hospital in Albania, the biggest one in Albania. In fact, in this study, I want to present today only one of the antineoplastic agents, which was studied, and the cost effectiveness of bortezomib, which is used for the treatment of multiple myeloma. Multiple myeloma, in fact, it is a disease that the origin of this, of the name of the disease comes from the Greek language myelo, which means bone marrow, and oma, which means tumor. So multiple myeloma is in fact a blood cancer or a bone marrow cancer tumor, which is related to lymphoma and leukemia. Otherwise, multiple myeloma is called also Caller's disease. Below, you can find a microscopic image of the plasmacytoma in people who are affected with multiple myeloma. Regarding the diagnosis of this disease, in persons who are suffering from multiple myeloma, from laboratory tests, you can see abnormal levels of antibodies like IgA, IgD, IgE, IgG, and IgM in the blood test. And also the appearance in the urine test of Bence-Jones protein, which is related to the urinary excretion of light chains of the kappa or lambda type of immunoglobulins. Also, from the bone marrow biopsy, you can see the appearance of cancerous plasma cells. Regarding the imaging tests, the imaging tests in persons who suffer from multiple myeloma show lesions in the bones and especially on the skull with this image, which is quite very impressive, and it's called pepper pot skull. You can see the skull, the bone of the skull is really like a pepper pot, but it's not the pepper that comes out, but the visible signs here in the bone are in fact the visible lesions of the bone in the skull. And also with the X-ray or some other imaging of the femur, you can also see lesions like this, which are presented in this slide. Regarding the clinical signs of multiple myeloma, in patients suffering from this disease, you can observe bone pain. So they tell the physician that they suffer from bone pain, around 70% of the patients, and especially they feel bone pain in the spine and in the ribs. They have also high levels of calcium in the blood. They have also normocytic or normochromic anemia. In persons who suffer from multiple myeloma, you can also see impairment of renal function due to the high expression of kappa or lambda chains of immunoglobulins, and also various infections like pneumonia or pyelonephritis, weight loss, and other signs that are specific clinical signs of this disease. We can say that multiple myeloma is a disease that from the data in 2015, the data have shown that this disease affects around 490 persons worldwide and causes around 100,000 deaths per year, let's say. The study and the data presented are data presented and found in the United States. In the United States, it affects around 6.5 people for 100 people per year, and 0.5 and 0.7% of individuals are affected during their life. The disease has a mortality of 3.4 persons for 100 persons per year. So you can see that around half of the people that are affected from multiple myeloma die within the year. The disease generally appears around the age of 60, 61, and is more common in men than in women. Without treatment, the average lifespan of this disease is around 6 to 7 months. And with current treatments, the life expectancy ranges from 4 to 5 years. So as you can see, multiple myeloma is nowadays is treated, but still remains incurable, unfortunately. There are several stages of multiple myeloma. It's stage 1, stage 2, and stage 3 of the disease. The classification in stages depends on the results of laboratory and imaging tests, and also the stage of the disease determines the category of risk and its aggressiveness. The stage and risk of multiple myeloma gives the physician a picture of the prognosis and treatment alternatives for each individual diagnosed with this disease. There are some treatment lines, pharmacological treatment lines for multiple myeloma. The first one is targeted therapy with bortezomib or carfilzomib. In our university hospital, we go with bortezomib as targeted therapy, and as you will see, the study is about the cost effectiveness of this drug in treating patients with multiple myeloma. Bortezomib and carfilzomib are protease inhibitors. These drugs block the activity of a myeloma cell substance which break down proteins, which is called protease. So these proteins, which do not break down as a result of protease inhibition, destroy the cancer cell in the people affected with multiple myeloma. Both bortezomib and carfilzomib are administered intravenously. Another treatment line is the biological treatment therapy with thalidomide, lenalidomide, and other drugs. These drugs, or the biological therapy, uses the body's immune system to fight the myeloma cells. Drugs that are part of this group strengthen the cells of the immune system to identify and attack cancer cells. All of these drugs can be administered orally or in other forms, but mainly are administered orally. Another treatment line is with chemotherapy. Chemotherapeutic drugs, kill fast-growing cells, including myeloma cells, and this treatment line is, let's say, the chosen treatment line for the patients that will go under stem cell transplantation. You can also treat the multiple myeloma with corticosteroids, and these substances are also active against myeloma cells, and corticosteroids can be taken orally or can be administered intravenously to patients. Regarding some treatment procedures that can be chosen for patients who suffer from multiple myeloma, one of these procedures is the stem cell transplantation. Unfortunately, in our hospital, we cannot provide to our patients yet the stem cell transplantation. But this procedure is a procedure for replacing diseased spinal cord with healthy spinal cord. Prior to stem cell transplantation, stem cells are collected from the patient's blood. The patient undergoes high doses of chemotherapy and in order to destroy the diseased spinal cord, and then after this procedure, the stem cells that are collected from the patient are injected into the body of the patient for the reconstruction of the bone marrow. Another procedure is undergoing radiotherapy, and this treatment uses X-rays to damage myeloma cells and stop them from growing. Radiotherapy can be used to shrink myeloma cells in specific areas. For example, when a group of abnormal plasma cells form a tumor that causes pain or destroys a bone. How to choose the treatment line for myeloma multiple? Combined treatment will be given based on the criteria whether the patient is a candidate or not for stem cell transplantation, which varies from the disease progression, the age of the patient, the medical condition. And if you are a candidate for stem cell transplantation, you will go the procedure as I mentioned prior in the slides above. And if you are not a candidate for stem cell transplantation, initial therapy will include chemotherapy combined with corticosteroids, and after that, target therapy or biological therapy. In our hospital, we choose the target therapy. In University Hospital Mother Theresa, we treat the patients that are in stage 1 and in stage 2 of multiple myeloma. Unfortunately, we do not treat the stage 3 of multiple myeloma. In stage 1 and stage 2, we administer to the persons vincristine, doxorubicin, and dexamethasone. So we administer chemotherapy and corticosteroids. In stage 3, we administer bortezomib and dexamethasone. The methodology of the study, we have selected to compare the cost saving for vial sharing and cost efficacy of individualized preparation before using and after using a safety cabinet for the preparation of bortezomib for patients treated in the hematology service of our hospital. The preparation of antineoplastic agents is performed in safety cabinets by the nurses under the supervision of hospital pharmacists. The safety cabinet for the preparation of antineoplastic agent was placed in the pharmacy of our hospital and in the internal medicine hospital that has also the hematology department at the end of 2015. So we have decided to start the study to be conducted from January 1st, 2015 until 30 June of 2015 before vial sharing, and from 1st of January 2016 to 30 of June 2016 after vial sharing, thereby enabling us to share vial contents between patients and minimize drug waste. Related to the criteria, it was decided to calculate the reduction in financial value of the cost treatment for each patient for one cycle of treatment with bortezomib. The cost comparison was performed calculating the value of the therapy with bortezomib before and after using the safety cabinet for the preparation of this drug. As a result, we found out that the average treatment cost for one patient in the period from 1st of January 2015 to 30 of June 2015, before the preparation of the drug in the safety cabinet, was around 1,000 euro. And the average treatment cost for one patient after the preparation of the drug in the safety cabinet varied from 657 to 743 euro for patient, depending this on the weight and on the body, let's say on the body weight of the patient, which is very important regarding the dosage that should be administered to each of the patients. So we found out that after using the safety cabinet for the preparation of bortezomib for treating patients who suffered from multiple myeloma, the reduction of treatment for each patient for each treatment cycle varied from 257 to 343 euro for each patient. And the reduction in terms of percentage varied from 26 to 34% for each patient. So as conclusion, the study showed a reduction in the cost of treatment for each patient for one treatment cycle in the value saved for bortezomib that varied from 257 to 343 euro. In percentage, the reduction varied from 26 to 34% in the reduction of the cost for each patient for each treatment cycle. An increase of the efficiency of use of the available financial resources and a better management of the hospital budget, and improved service to patients who are treated in the hematology service and suffer from multiple myeloma in the University Center, Hospital Center, Mother Theresa in Albania. As a recommendation, we think that further studies are needed to estimate the reduction in the treatment cost for each drug prepared in the safety cabinet in order to have a complete estimate of the savings in euro for each drug prepared in the safety cabinet. Safety cabinet installation and functionality of the hospital pharmacies where antineoplastic agents are administered are in the focus, and also the preparation of all antineoplastic drugs in safety cabinets in light of the study shown evidence of cost reduction and better patient care. So we recommend a centralized unit for the preparation of the antineoplastic drugs in safety cabinets in the hospital pharmacy of our University Hospital Center. Thank you for your attention.